Hi, this is Ann Alton, staff physical therapist coming to you from the Kirk Center for Healthy Living. I'm going to talk to you a little bit more today about Ehlers-Danlos syndrome. I thought I'd talk to you a little bit. I mentioned in the first video that there are like 14 different kinds, that may be 13. I can't count. Anyway, but I thought I'd talk to you a little bit about what those different types are and what they kind of look like, what's different about them, and what differentiates them from the other types of Ehlers-Danlos that are out there. So that maybe you might recognize yourself in one of these, or just the hypermobile type, which is, like I said before, it's a clinical diagnosis. Which means that there is no test for it. It's just they go off of your symptoms. And if you hit a certain criteria, a number of symptoms, then they give you that diagnosis. The rest of these all have genes that are associated, so you can genetically test for that. Okay. The first type I want to talk to you about is called classical. Its main things are skin hyperextensibility, general joint hypermobility, and you can also have some abnormal scarring or skin fragility. Okay, less specific, you can also see some like really velvet skin, molluscoid pseudotumors, and sub-Q spheroids, which those are just like little round nodules underneath your skin that are really hard. They're like calcified. Sprains and strains frequent. Hypotonia, which means that like your muscles are kind of floppy. They don't have the tone that a lot of people have. They're just you might also see some gross motor delays with that in a child. Easily bruised, hernias, prolapses, especially in childhood, and surgical complications like hernias, and family history. So the second type is classical-like, and so I said second type, which seems like I'm going to count, but I probably will lose count at some point. So. But anyway, the second type is classical-like, and it's really similar, but it's got skin hyperextensibility, which means that you can pull your skin, and they have actual measurements that they say, okay, if you can pull your skin a certain amount up off of your forearm or off of your hand, that qualifies. Velvety skin, but interestingly enough, absent is the abnormal scarring that you see with classical and hypermobile types. General joint hypermobility, also easy to bruise, or even sometimes there's spontaneous bruising, where your skin is just discolored because of broken blood vessels underneath the skin and you didn't do anything to deserve it. Less specific, there are some genitourinary or uterine complications that are associated. There's also some facial features that are common for these. And I'm not going to go over each and every single one of these, but there are some specific facial features that are associated with these. So, for example, this one is lax skin, a high palate, in the mouth, and that kind of asymmetrical face. There's some cardiovascular issues, and there's also some muscle weakness. So the third one, cardiac valvular EDS. Okay, this is not to be confused with cardiovascular. This is cardiac valvular EDS. This is severe progressive cardiac valvular problems. So like your mitral valve or your aortic valve, severe and progressive problems with those, often starts young. Skin is also hyperextensible, velvety, the scarring is there, there's thin skin, easy for me to say, and easy bruising. And you can have general joint hypermobility, or you can have just some specific joints. So it doesn't have to be all your joints. So vascular EDS, they look for a family history. There's usually some arterial rupture at a young age for no discernible reason. Sometimes you get a spontaneous sigmoid colon rupture. So the large intestine starts off on the right side, it goes up, it comes across, it goes down on the left side, and then it does kind of a U-bend, and then it goes out into the rectum to leave the body. That U-bend is the sigmoid colon, and so there's a spontaneous rupture that they see sometimes in vascular EDS. They also see uterine ruptures, especially in the third trimester. So if you think that you might have some sort of EDS, any type, it's really good to get typed so that you know if you have vascular or not. And some other ones also have the same issue with the uterine ruptures. And this is absent like any kind of C-section, previous C-section, or, you know, severe peripartum tears. So any like down on your pelvic floor, any tearing there. So it's good to get yourself tested if you're female, so that you know if that's an issue for you. And also if you're done with your childbearing years and you have daughters, you might want to get tested so that if they may carry the gene as well, and that they might be at risk for that. There's also a carotid cavernous sinus fistula without any trauma. Now this fistula just means there's a connection between two different structures in the body that wouldn't normally be there. And so this happens in the carotid arteries, which are right in here. And that's absent any kind of trauma, so there's no whiplash or anything like that that might have caused it. It just kind of appears. The next one is the hypermobile EDS, which I talked a lot about in our first video. It's those signs that I talked about. You know, can you overlap? Can you have your thumb out? Can you touch the floor with your palms? There's a whole set of criteria that you can find on the EDS website. And speaking of which, most of the information that I get is actually from the EDS Society, which is Ehlers-Danlos.org. And you can find a lot of that. Some of this I also get from a blog that's really great called Twist, and it twist stands for "That's Why I'm So Tired." So Twist, that's why I'm so tired, and it's about EDS. And so it's a really great blog. She's done a lot of research, and so I get some of my information from there as well. So we talked a lot about that in the first video. Then there's arthrochalasia EDS. I believe I'm pronouncing that correctly. It's either that or arthrochalasia EDS. You find this congenital bilateral, both sides, hip dislocations, like as a baby. Severe joint hypermobility general over the whole body. You have skin hyperextensibility. There's some specific facial features. There's some mild learning disability. And there can be some seizures or some like others, like some stroke-like symptoms that go along with this, and a motor delay that are common with this type. There's some of these are really hard to say. I practice this too. It's DERMATOSPRAXIS EDS. There are 9 major and 11 minor criteria. Among them are extreme skin fragility. There are craniofacial characteristics, so facial features, such as protuberant eyes and really sagging skin. And then there may be a mild delay of neurological. Kyphoscoliotic EDS, you find like loose muscles, early onset of kyphoscoliosis. So kyphoscoliosis is not just your normal scoliosis where your spine bends to the side, but also it bends forward. So a lot of times you'll see a person with, one shoulder blade higher than the other, and they also have scoliosis along with it, and a rounded forward upper back. Okay, that's the main characteristic of that one. It's usually pretty severe. The skin can be soft and doughy or velvety. It can be fragile with easy bruising. There's also some abnormal healing that goes along with this. And intelligence is usually considered to be in the normal range. There's brittle cornea syndrome, where you have thin corneas. You have early onset progressive keratoconus or keratoglobus, which basically just means hardening of either the sclera of the eye or of the actual orb of the eye. And blue sclera. Instead of being whites around the eyes, they have a bluish tinge. Then there's Spondylodius Phratic Eds. I'm starting to get tired and my handwriting is bad. But these people have a short stature. They have loose muscles and some bowing of the limbs. So they may have like bowed legs and bowed arms that aren't quite straight. So that's pretty typical for them. Just a couple more. Hang in there with me. There's Musculocontractual Eds. You find contractures, multiple like joints, the contractures, where they won't extend. They're just shorter than they should be. And that's congenital. That starts very early on. There's some facial features. And again, there's some skin issues, the hyperextensibility, the bruising, the scarring. But interestingly enough, this also includes increase in wrinkles in the palm. So there's myopathic EDS. So you have muscle weakness and the tone just isn't there. You have proximal joint contractures. So you may have joint contractures up here and in your hips and thighs, but you have very hypermobile distal joints, so wrists and ankles, okay? And then there's periodontal, the EDS, is the very last one. And this is severe intractable periodontal issues, periodontitis Eds, early onset. It's so like bleeding gums and like the gingivitis kind of thing. There's a lack of attached gingiva. So again, gingivitis is the gums around. So there's they kind of separate from the teeth, and lots of plaques. And then there's the family history. So as you can see, there are a lot of different ways that this can present. So if you recognize yourself in any one of these, you might want to talk to your doctor and see about getting some genetic testing. And I apologize for taking 14 minutes, but I hope you learned a little bit, and I will see you next visit, which will be what can PT do for me if I have EDS. So I'll talk to you then. Thanks.